Good afternoon, or I suppose good morning if you're on the West Coast. I'm Tim Regan. I'm the senior editor of Senior Housing News. Welcome to our webinar on how tech-enabled senior living can help operators prioritize safety, connection, and care. You know, I think if you've read Senior Housing News over, the last few years, really, then you probably know that operators have a growing number of tools that they can use to help them keep residents safe and connected to the outside world. You know, I have been very interested in how operators have used technology to do things like detect falls, connect residents with remote care, and also increase staff efficiency when I think we all know that that is sorely needed. So we're going to have an interesting discussion today. We're going to talk about all these topics and more. I want to introduce our panelists briefly, and I'll let them sort of introduce themselves a little bit longer here in a moment. But before we do, we have Ben Zaniello. Ben is Chief Medical Officer and Chief Product Officer at Best Buy Health. We also have Chris Null. Chris is Chief Technology Officer at Atria Senior Living. And we've got Frank Vetter, who is Chief Information Officer for LCS and its family of companies. So Ben, Chris, Frank, I'm very excited to talk with you all today. Welcome. And welcome to our audience. Some housekeeping items for all of you tuning in before we start. You can participate with us today, meaning you can ask questions, you can even submit comments if you want and they're relevant. Just make sure that you do that using the Q&A box on your On24 window. Don't type it into the chat. No one will see it. Just put it in Q&A. We'll try to get to them throughout our presentation today. Also, of course, I want to thank our wonderful sponsor, Best Buy Health, for making this happen and for creating this wonderful topic for our readers and viewers. All right. Well, we have a lot to talk about in the next hour, so let's just jump into it. I thought that we could start with an introduction so that everyone sort of knows what you do, who you are, and your role in the wider industry. So Dr. Zaniello, maybe we'll start with you. Tell us more about your role as Chief Medical Officer and Chief Product Officer at Best Buy Health.
Sure. Howdy, everyone. And Tim, thanks for having us and excited to be here. So yes, I am the Chief Medical and Product Officer for Best Buy Health. What I probably should spend a second on is answering the question that we usually get early in these things, which is, am I here to sell you TVs? I promise that I am not, unless you want to buy one, in which case you should absolutely go to Best Buy. But of course, Best Buy, from a health perspective, is very focused on technology, particularly healthcare technology in this case, in the home, in senior living, et cetera. So I'll talk a little bit later on as we go through advancements in health tech, what are cool things that you could potentially be doing in your senior living facility. So again, thanks for having me. Excited to be here.
Yeah, thanks, Ben. Chris, how about you? What do you do at Atria?
Nice to meet everybody. Chris Null. I've been the Chief Technology Officer at Atria for the past 4 years, and I'm fortunate to lead the Information Technology Department. And our big focus is in-room digital experiences for our residents. So we're doing a tremendous amount of investment, innovation to prepare our rooms for the residents of the future. The residents expect the high-speed wireless, expect all the bells and whistles. They want Amazon Alexas. So it's a great company to work with. We have about 210 communities across the U.S. and Canada, and headquartered here in Louisville, Kentucky.
Great. Frank, how about you as Chief Information Officer at LCS? Tell us about that role.
Sure, appreciate it. So yeah, I lead the data technology innovation efforts here for the family of companies and life care services. And, you know, we serve the industry and we're purely focused on the senior living industry, but we serve it in a variety of ways. You know, we provide management services to both rental and life plan communities. You know, as the technology leader, you know, I'm a company who serves nearly 40,000 residents. You know, I've seen firsthand how innovation can really affect the quality of life for our seniors. And so, it's just an honor to be here today with Ben and Chris, a couple of great thought leaders, to talk about how technology can continue to transform our industry.
Yeah, absolutely. Well, we have a lot to talk about. Let's start with kind of a big question. And Frank, since I just heard from you, maybe I'll start with you, and then Chris, I'll ask you this question. This is sort of an overview of the general market and the trends you're seeing. What are you seeing out there in the market with regard to tech? Are there trends or challenges that are shaping how your teams are thinking about how you're investing in tech or innovating with it? Tell us more about that, Frank.
Sure. As you think about it, I can't imagine a forum like this where you don't recognize what I'll just call the abundance of optimism of AI, and whether that's in senior living or any industry you touch, we're all confident that it's going to change how we work, but how that plays out is still being formulated a little bit. When I think about senior living more specifically, one of the major shifts that I feel like I'm seeing is really kind of the underlying capabilities that's going to bring AI to life. And if more than ever, we're a data-driven organization, we're a data-driven industry. I feel like that's transformational in many ways. And what's driving that? What are the major industry trends that are driving those technology forces? I look at two key things. One, LCS is, I think, most of the senior living communities are really enhancing and doubling down on the focus of being a wellness-driven organization, not just a healthcare organization. And to do that, you've got to understand all parts of your resident's journey. And then the other part about it is, there's no scenario where you're not looking at the opportunity to serve more seniors, but the necessity of making sure that the staff, which is going to be challenging to get in the future, is as efficient as possible. So when I think about the drivers that's affecting technology, those are some of the big ones that jump to mind.
Interesting. Thanks, Frank. Chris, how about you? What are you seeing in the market this year with regard to tech? And talk to us about some of the trends and the challenges that are shaping how you're thinking about all that.
I think we have to say AI with every interaction we have. I agree with Frank. It's definitely how we're monetizing it. I'm seeing two areas. One of them, it's almost a hesitancy to move into some of our communities from our seniors. It's a lot of uncertainty in the world, so I think more focus on CRM, more focus on the upfront engagement, inviting people to public activities on the sales side. From a tech perspective, we're putting a lot more into cybersecurity. It's definitely on the uptake. It's a nonstop investment, but it's something, unfortunately, people are targeting our population. So as we go into a community and introduce new technology, we also are introducing education around how to protect yourself, how not to fall for scams, how to tell if there's an impersonation. So it's been an interesting journey so far this year. But we're excited about where we're moving forward. I think AI in particular, it's how are we monetizing AI? How are we describing a good ROI? Whether it's staff simplification or just getting information faster about a resident to make a decision.
Yeah. So obviously we heard the operator perspective. Ben, I'll ask you this question, but I'm curious how Best Buy Health sees the landscape for tech right now. What do you see as the top trends or challenges?
Yeah, I mean, I wish I could do more for the cybersecurity thing for Chris. As I thought about that, and I thought about my own parents and loved ones, that is a concern. I think we're at this golden age of hardware today, where we're actually producing ambient devices. We're able to capture a lot of things that are happening. I think the risk, therefore, is knowing kind of what to do with it, information overload, and making the devices kind of smart and not purely present. So I kind of agree with this kind of general AI perspective, which is turning these kind of dumb devices into things that go beyond just there was a fall, but also getting that fall information into the right person and giving them an opportunity to do something about it and what they should do about it. I think that kind of level of intelligence is going to be layered on because, again, before it was all dependent on human intervention and human interaction. And that, from an efficiency standpoint, is pretty much a dead end. Just throwing warm bodies at a problem almost never solves anything. So like Chris and Frank, I'm excited about that not only are we able to get more devices more cheaply into senior living, into home environments, but that we can actually do something with the information without great cost.
Great. I want to stick with you, Ben, for a question on things like remote monitoring, fall detection. I want to come at this from a clinical lens. How do you think that capabilities like remote monitoring, detecting someone if they fall, how does that impact early intervention and operators' ability to manage residents' chronic conditions?
Yeah, I mean, it actually is a little bit a good segue from what I was talking about before, which is visibility obviously gets you part of the way there. So with all these devices we can put in, and obviously in this population, it really starts with fall detection, right? What's the kind of the highest risk, most urgent thing that can happen, and it's certainly a fall in this population. And so we have great devices out there that can capture the fall. Okay, then it goes to, what are we going to do with it? What is the intervention that's meaningful? We obviously have a lot of fall prevention programs. A lot of senior living facilities I love have aggressive kind of fall prevention programs already within them to make the inevitable fall safer, which I think is really important. So clinically, I'm enthused by that. But also now it's taking all that data we're capturing from all these devices and figuring out how we detect falls before they happen, so that we can then kind of flag who is at higher risk. Now, that then goes to the efficiency piece, which I touched on earlier, which is great. Like, I can probably guess from a data stack perspective that most people in a senior living facility have some level of fall risk. So then I need to go to the next question, which is, which are the highest risk people? What are the right programs and intervention that make a difference with them, whether it's purely medical or physical, padding, canes, that sort of piece, I think are really, really important. Again, it goes back to we don't do people any favors by creating a lot of new data about them without the right ingestion mechanism, without giving visibility of that data to the right people, whether it's taking all these remote patient monitoring devices, blood pressure cuffs, fall detection devices, and then actually getting it back to the providers so that they know that this person, they just put them on a new blood pressure medication. It's lowering their blood pressure too much. It's actually putting them at risk of a fall. That's a clinical decision. And needs to go back to the provider. So integrating into Epic, integrating to the electronic medical records, again, putting the data in the hands of the people that can actually intervene, I think we're starting to see more often. It's certainly a focus of ours at Best Buy. And I think will actually mean that we can start affecting the outcome, which is reducing falls, for example.
Great. We had a question from our audience here, and actually, I just want to mention we were getting a little bit of static. Someone had mentioned distracting background noise, so we'll try to figure that out. But for anyone that's hearing that, we'll try to nip that in the bud, and we're sorry about that. Ben, I have another question for you. Something that I hear from senior living operators quite a bit with regard to implementing new tech is, look, we've got all of these workers; they're working very hard. We have things that we want them to do. Sometimes there's multiple devices, multiple platforms that workers are using in communities. Operators have told me we have to be careful not to overwhelm staff with some of these new processes. So can you answer that question? How do you ensure that these tools can, affect health outcomes in a positive way without, overwhelming people?
Yeah, I mean, I think you have to think about the efficiency aspect of all of these, which is, are they great? They may lead to a clinical outcome, but it could be hugely inefficient. So let's look at the way that the intervention, the device, the data that we are having flow actually contributes to efficiency. And the example I always use of this is, if you increase visibility into one of your rooms, you can actually decrease the amount of time you spend on that room with the right type of alarm mechanism. So in other words, where typically you can have a ratio that forces you to have one person kind of looking over a set of rooms or a set of facilities, with RPM, you can actually reduce the amount of people you need to oversee them, because the alarming structure is going to tell you when the events happen. So I think there are efficiency opportunities. But again, the recurring theme that I think we've already touched on, which is we have to ensure that we're not creating a bunch of capturing a bunch of incidents, creating visibility into falls, creating a bunch of data without anybody that's appropriate to catch it. One of the data visibility things that we also focus on is, again, that kind of community aspect of healthcare, and understanding that the role of the provider within the senior living community really needs to be supported by the healthcare community at large, whether it's health plans, for example, that offer fall detection devices as part of a supplemental benefit. And therefore, that information is actually going to that health plan and their care providers. So it's benefiting the senior living community without putting a tremendous amount of cost and inefficiency on their operations.
I want to try to turn this into a kind of a clear-cut example for our audience. So, Chris, I'll ask you. I wanted to ask you, can you share a moment where you think that technology directly enhanced a resident's life at Atria? I guess, yeah, give us an example of some of this at work.
Yeah, Tim, absolutely. One that we're extremely proud of is we've been able to deploy roughly 2,000 to 3,000 Amazon Alexas in rooms. And we had a couple in particular in Newport Beach, California. We have an 8-year senior living there, IL, and memory care. And as part of our implementation, we were able to see the engagement, so participation in events, increase close to 50%, because we're using this piece of technology for communications, reminders, music. And I think probably like actually the music side of it has really opened up decades of opportunity for our residents to go back to their early childhood, their marriage. And one couple in particular, when we first showed it to them, they asked it to play their wedding song from the 50s, and it, instantly came out, brought smiles to their face. I mean, that's why we do a lot of this, is just, enhancing their experience, enhancing their engagement, and just an awesome moment.
Great. I was going to ask you a question about presenting tech rollouts to residents and staff. We actually got an audience question, I think, kind of serves the same purpose. So I wanted to share. Someone tuning in said, "I'm an operator. Fall prevention is my focus. How do we take that data and make it available to staff?" So my question was, what have you learned about how new tech rollouts need to be presented to residents and staff? So I think we're asking kind of the same thing here.
I think on the staff side, we have to keep it simple. We have to keep it ROI enabled on there. So when I say ROI, what's in it for them? From the data side, the best thing about AI is you can point a lot of these agents at a big data set, and it can quickly answer questions. And that's what we've tried to do with some of the insights is, quick answers, who's having a bad day today? Well, I can look at my engagement data, my e-call data, and, participation data, and quickly give you 5 names on, with close certainty on who's having a bad day. So I think that's, on the staff side, it's making their job easier. On the resident side, it's extending length of stay, happiness, and then as well as like saving them financially. So we actually have a similar project on just triple play with cable, Wi-Fi, internet that saves our residents a significant amount of money, as well as it helps my team because we get connectivity in more rooms. So I think you gotta both sell the staff so that they won't push back on it, so that their ROI, and then on the resident side, what's in it for me. Coming from a different industry, it's definitely more difficult because at the same time you've got a lower tech acumen. So, it's a fun area to be in, but it's definitely you've got to spend the time on the change management. You can't gleam over that.
That's a great segue into something I wanted to ask you, Frank. Technology obviously needs a lot of infrastructure to work. You have to have Wi-Fi, sometimes you have to have fiber optic cables that can support, all kinds of bandwidth. So tell us about the infrastructure that you think is essential to support some of the things we've talked about today across a portfolio of communities.
Yeah, that's a great question. And, it's as simple as it sounds, it's shocking how fundamental simple information security and connectivity are. They're absolutely critical. And LCS, when we have the opportunity to serve new seniors and owners and boards, maybe a new community comes into our management, it's not uncommon to see a little bit of malnourishment in that infrastructure. And that gives a lot of concerns about how the information is protected, how well defended the computers are, and et cetera. And so it does give me the perception that as an industry, we're maybe a little bit behind in some of that fundamental connectivity. As I think about all the things that we've talked about and what we will continue, having a robust Wi-Fi, truly campus-wide, it's as important as having electricity in the future. When we think about that, whether it's whatever residents experience in their own home, they don't have connectivity problems. They have an increasing number of devices. They have their own private network, and et cetera. And so do we think they should expect less when they move into a senior community like ours? I don't think so. And, earlier we talked about the challenges of making sure staff is more effective than ever. Imagine staff members that have to run back to some central location to get the information they need to be able to access an application to be able to do their job, as opposed to being able to securely log into any application on a mobile device anywhere in campus. And when we can't provide those type of capabilities, it's not the experience we want for our residents, and it's just very inefficient for our staff members. Flipping to the security side of it, and Chris mentioned it earlier, we have a higher degree of sophistication attacking our communities every day. I don't think that's a secret. But what I worry about is if we are collectively as an industry not investing in this way, I would hate to see a series of breaches that make our industry look bad, and that look like we are not protecting some of the most vulnerable residents in our nation. And so making sure that we take those things, give them the severity and the attention that they deserve, because it's just essential, whether it's the residents' data, whether it's staff data, operational. But to put all this together, one thing I'm going to guess, if we were to go back 10, 15 years, the idea of an IT directorate at a community almost didn't exist. And so as we look at it today, what part of the community is not tech-enabled, tech-dependent? What are the growing needs of support needed for our residents? I think having focused technology leadership is some of the... Well, that was distracting. I got a Teams call. Having focused technology leadership at some of our communities is more essential than ever, whether it's for security, technology planning. So, it's as simple as it is. Connectivity and security are the absolute bedrock.
Great. We had a question from our audience here to define some jargon, which I'm always happy to do. They asked, what is ROI? That's return on investment. So always happy to help spell out some of these acronyms that we all use. Frank, something that I also hear from operators is, okay, maybe we're collecting all this data now, and I know that LCS has a data science team to pour through this data, but operators would tell me, we have all this data, we don't necessarily know what to do with it. like we have all of this, and we think it could help improve care, but how do we start? So I'll ask you that question as as someone from a company that has a lot of sophistication around data analytics. How are you using your analytics capabilities to guide care improvements or to make better operational decisions?
Yeah, I think, and we have made tremendous investments. We've built a from the ground up data warehouse where we pull in information from every experience point, every transactional process across our communities. And while we have a long ways to go, what we've done so far has just been completely transformational. It is a very conscious step away from where I think many things have been in our industry. Historically, you would buy a standalone system and you'd go to that system and look at the built-in reports and look backwards to see what happened in the past. We don't believe that that's the right strategy anymore. The need to pull that information to make it available for analytics, data warehousing, data science team is just transformational. Our operational leaders have been able to see our communities in an entirely new light. And some of that comes down to seeing the linkages, whether that is how does something like care or wellness trend affect inventory management? How does menu selection drive staffing? You can't get that information if you don't harvest it and be able to put it into a warehouse where you can actually combine that information and put advanced analytics tools on top of it. But it's helped us change our way of thinking away from what has happened, not only to what's going to happen, but what should we do about it? And so having a very dedicated focus on bringing together those systems, correlating the data, putting AI on top of it, it's just given us a wealth of opportunities, and it's transformative. And the things we can imagine in the future are just pretty still exciting, yes, even as far as we've come.
That's great. I want to shift our discussion to workforce. Before we do that, we're almost halfway through our discussion here. We've been getting a lot of really good audience questions, which I will ask a couple more here in a moment. Just wanted to remind our audience, if you've got questions, comments, send them in the Q&A box. Seems like you're pretty good at doing that already, but just a reminder. And before we move on, Ben, since it's been a moment since I heard from you, do you have any thoughts to add about any of the things we've been talking about so far today?
I would just echo something that has already been said, which is about just the base technology infrastructure. Unsurprisingly, a big part of our business at Best Buy is Geek Squad, and is often being dispatched either by people themselves or their loved ones, their caregivers, to go into the home and ensure that they have working Wi-Fi, that it is connected to the right thing, et cetera. And I am constantly struck by both the desire for that high-speed access, 80-plus-year-olds complaining about their browsing speeds, which is just the most wonderful thing to hear. Well, depending on the circumstance, if you're related to them or not. And then secondarily, just the general use of it and how that it unlocks everything, like to Chris's point, music access and environment, and beyond just the clinical ramifications of it, being able to, again, source data and provide data providers, et cetera, to, again, just create a better living and a more comfortable living. So I love that this was brought up, because we instantly dive into specific devices and use cases, but there is a baseline of infrastructure that you need to start with before you do anything else.
Perfect. We got a couple questions here about fall detection technology. So I want to try to address this before we move on to workforce. Chris, since we haven't heard from you for just a moment, maybe I'll start with you here. There was a question about, can you talk about how fall detection devices have advanced over the last few years? They said they still hear a lot about false positives. And then someone else had asked, have you ever widely deployed a resident monitoring solution for fall prevention and occupancy activity monitoring? So two interesting questions there about fall detection, fall prevention. Chris, can you tell us more about how Atria?
We've turned it on and turned it off a few times. You know, it is a mixed bag. The most advanced fall detection in the world from the Apple iWatch is 50/50. However, we've actually invested in some technology on fall, detection ratings. So we've got a particular piece of technology from 𝗭𝗵𝗿𝗶𝗀 where we'll use that to do an assessment of our residents' fall risk. And then we'll curate our PT around that, because in our view, once the falls happen, it's potentially game over of living with us. The damage is done. So we've definitely invested significantly more on the care reviews, the fall risk assessment. And I definitely agree with the whoever asked the question. There's a myriad of technology out there. We've just chosen to focus more on how do we prevent the falls up front.
Yeah. Frank, I saw you nodding your head. Before we talk about workforce, any thoughts about fall detection or prevention?
Yeah, I mean, I definitely agree with Chris's point that it's trying to assess the risk up front, is absolutely critical. I think if we were to go back 2 or 3 years ago, there was probably a hope that, you could identify a person who was nearing a fall condition and get a caregiver in position to physically prevent that fall through advanced alerts and et cetera. And I think in reality, that's just not happening. So it's understanding the risk characteristics of the person, understanding the risk characteristics of the room, understanding the probability of different conditions. It is the real answer. You definitely need to learn what you can after a fall has occurred, but just couldn't agree more with the value of prevention versus an attempt at a cure per se.
Ben, do you have anything? Great. Ben,
Yeah,
do you have anything to add to this?
Yeah, we spend a lot of time in fall detection at Best Buy. Partially, we have our own device, the Lively device, in this market, but also we sell a lot of devices from, as Chris mentioned, kind of the Apple Watch to things less sophisticated. I think it's a fascinating space, and even though the tech has been around 20 plus years, we're still at kind of first generation, I feel, here for all the things mentioned. The number one thing is, are they actually wearing the device, right? Back to the Apple Watch question, generally too sophisticated a device for most, but not all senior living residents. We have a lanyard, for example, but they have to put it on. I'm incredibly excited by the work being done here, partially just the physicality of like ambient monitoring and just having it on and present. And then the second piece, going back to data and analytics, which is getting to the next generation where, like with most ambient devices, just as everybody is shouting at their Alexa all the time, getting to the next level with ambient devices where a fall is truly a fall. And again, taking that data and going into fall risk and fall prevention. So this space is super interesting, and I want people to invest kind of time and effort, partially because we need the data to make it better and more sophisticated, but we have a lot of work to do.
Great. Let's talk about workforce challenges a little bit. So, I think it's no secret to anyone that's in senior living how difficult staffing is. I think that was the case before the COVID-19 pandemic, 5 years ago. It's only gotten harder, I think, since then in some ways. So obviously, I think, what I hear from a lot of operators is we're trying to use technology to help fill that gap, by basically taking things off of workers' plates so that they can focus on the thing that they do best, which is, caring for residents, being with them. So I wanted to ask you, and Chris, I'll start with you. How do you think that the current realities for senior living staffing make it critical or maybe more challenging to adopt new technology?
I think obviously there's the train up period. That's why we've been big fans of voice technology, big fans of simplicity. We're actually, I wasn't told to say this, but we're actually a big user of the Best Buy Lively device. The back end of it are centralized call centers. So if our resident needs help, they can immediately hit a button and get a two-way radio to a 911 trained agent. And, you know, I think if people look at that abstractly, they're like, so you're sending them to a call center? We're like, no, we're sending them to a group dedicated to solving their problems, triaging, and it's trained to help them where we don't have the staff. And it's it's not we can't find the staff. It's some of them have not come back to work since the pandemic hit. So we've been extremely happy with that service. It's allowed us to rearrange staff to focus on, engagement, cleanliness, upkeep of communities versus some of the check-ins. And it's only on our independent living side. These are individuals that are, still independent, want to be independent, but this is a good backstop to keeping them safe and secure.
Chris, what is Atria doing behind the scenes to make sure that technology isn't adding friction for its frontline teams?
For us, we start early on the change side. We like to bring in on our steering committees, resident engagement team members, some of our nursing team members. We have a cross-functional team that we do the change acceleration with them, and then we introduce it at a community, but with the benefits of this is how your job should be easier. This is how support should be simpler. And I think you have to do that. The age of pushing out tools and hoping employees were fine with them is just not, palatable in the 2020s. It's something that, worked 20, 30 years ago, but, employees have many, many other choices. Every single employee has their own supercomputer attached to them. So we have to keep it simple. We have to ensure we go in with no support, and we have to make them part of the rollout.
Yeah. Frank, I think we addressed this a little bit earlier, but how do you make sure that when you are using something at LCS, that what you're using is intuitive and that people that maybe stretched thin can hop into it and start using it without too much complexity?
Yeah, I certainly agree with Chris's point on change management. And, I think we've always need to learn how to be better in that space. A few things we're doing to couple that and to augment that is we've actually started introducing UX or user experience training into our IT staff. So really training our team how to look at an end user interface to make sure that it is almost tested for usability. And so we're still early on our journey, but I'm excited about how that can continue to evolve. Our system design thinking is really kind of taking that UX perspective. I think we do the normal things like any other organization. When we deploy a new technology, we are acutely monitoring where we get feedback, whether that's in tickets or otherwise, that really can direct us to what part of the interface, what part of the process needs to help. I don't think there's anything special about that. But the other part I would point to, and I would say 2 years ago, we really started trying to shift our focus. In the past, we would often take a systems focus. How do we optimize the CRM system? How do we optimize the EHR system? How do we optimize the financial system? And that brought us a lot of benefits. But increasingly, we've been trying to ask ourselves, how do we move away from a system focus and into a business process focus? If you think about an example where a resident moves into a community, there's an interaction with the sales system, there's an interaction with unit inventory, there's an interaction with financial validation, healthcare record, all of those things. And if we were to only look at how to improve technology through the lens of those siloed platforms, I really think we'd miss the ball a little bit. So I'm not going to claim that we're fully there, but trying to shift our thinking to how do we optimize the process and not any individual system or technology. I think it's got a lot of opportunities in front of us, and we're already seeing some wins from that mindset shift.
Yeah. We hear often from senior living operators, we're looking at a wide range of tech. We're trying to figure out what's worth investing in. We're demoing things. We're piloting them. We've got this budget that changes depending on what we want to invest in. But it still seems like there's a lot of questions about investing, where to put your money, how to budget for all of this. So I wanted to ask some questions about specifically investing in technology. Frank, I'll start with you here. Can you tell us how LCS is prioritizing its technology investments this year, and then what you're basing those decisions on? That's like one of the number one questions I get from operators about tech.
Yeah. One of our large focuses this year is, I'll just say, optimizing our electronic healthcare record. And while that may sound like bread and butter and table stakes, it's really not for us. As I mentioned before, our passion around taking a very holistic approach to wellness is pushing us to say, how do we garner all of the information we can from the various interactions we have in serving our residents? So as we build out the EHR platform, not only is it intended to provide efficiencies to the staff, we've talked about how important that is, but give us a complete view of our customer. And so that's a pretty huge focus for us, because it's really foundational for how we look at every aspect and use that, every aspect of customer relation, resident touch, and use that to continue to evolve our services. In parallel with that, we talked earlier about fall prevention, and I'll even include upgrading nurse call systems just a bit. And to me, these are just win-win-win opportunities. Win from the healthcare outcome perspective, win from an effectiveness of an efficiency of our caregivers, and win in terms of just identifying operational improvements. And I hear that, as I talk to other senior living leaders, is there's, I think, a unique opportunity to prioritize that and get a lot of value from some of those focus areas. So that's how we're looking at the world in terms of prioritizing technology right now.
Chris, how about you? How does Atria look at prioritizing tech investments, and what are some of the things guiding those decisions?
This year in particular, it's been tighter, I would say. The economy's tighter. However, what we have to make sure is we're in lockstep with some of our owner groups. In particular, the two biggest areas we're really focused on is engagement and further foundational technology. We've got, we spun off the 𝗭𝗏𝗏 software company a couple of years ago. It's a great CRM, great software, but we're investing a lot in the the Wi-Fi, the connectivity, the in-room. Our industry is just tremendous, way behind, and we're not, you don't sell that like as a IT person would sell it. We sell it as, this is driving happiness for the residents. This is driving connectivity to their loved ones. And this is enabling all the futuristic tech that we can do, all the remote monitoring, all the cameras, when droids get out there and start helping us out more. You can't do any of that without wireless. So we have to package in and really highlight the, those three key areas of how we're making the community stronger, better, and then how does that translate to driving occupancy?
Yeah. What are some of the factors that you look at that help you decide whether something's worth implementing now, or whether maybe it needs some more time in the oven and you'll look at it a few years down the road?
We typically do a full community pilot, pre and post, where we're measuring occupancy, we're measuring, we're not putting the service in for free. That's been a challenge. You can't add any sort of connectivity for under $200,000 a building. So how do we recoup that investment? And we really tie it back to the, we can drive occupancy, we can drive engagement. Those have dollar values attached to them for our residents. So that's been how I've been able to sell this initiative, through my management and through our ownership groups.
Yeah. Frank, I know that you just talked about investing. Is there anything more that you can tell us about how LCS looks at whether to implement something now or whether to implement it later?
Yeah. I break it into two categories. If I look at it from a technology perspective, there's got to be a certain set of maturity. And when I say that, I focus on two aspects. One is, for any business system, can we get the data back out of it? Because that's super important, as we've talked about over and over. But also, is the system open for integration? I think our industry has a bit of a history of standalone silos type platforms. And I think the days for those type of systems are done. So, it has to have a certain degree of technology maturity and sophistication for us to consider it an enterprise platform. Beyond that, I would say that a driving force of what we view as good to invest in now is anything that can really drive optimization of our staff. How do we get our great caregivers out there spending more time with residents and less time back at their desk trying to figure out how to use systems? And so that productivity is a pretty high factor in terms of where we want to spend our energy.
Yeah. Well, we're here. It's about the fourth quarter of our discussion, if you can believe it. We've got about 15 minutes left. So if you've got more questions for our great panelists, send them in now. Frank, I'll stick with you. I wanted to ask you a follow-up. Cost, staff bandwidth, value, those all seem like things you have to juggle here. And, I could see how one of those would be, more of a priority than the others. But how do you balance all those things when you're doing all of this?
Boy, if I had a magic bullet, that would be pretty awesome. I think at LCS, we are increasing our investment in technology because we're seeing great returns. Having said that, there is definitely pressures on our and all other cost factors within our communities, and we have to recognize that. Overall, I think one of our biggest throttling factors is almost change fatigue. Our operators are doing an amazing job of producing healthcare outcomes, operational outcomes at our communities. And as we look at rolling out technology, we want to make sure we're supporting that and not disrupting it. So the speed of change is super important to manage. You ask about long-term value, and I guess I'm super optimistic that we've got several things ahead of us where we can see some great returns on technology investments. We need to just make sure that we're deploying it in a consumable way that supports the great work that's happening in our communities today.
Great. And also, Frank, do you have an example of a recent investment that would help put some of these pieces together that has, delivered a measurable impact that you can talk about?
Yeah. Well, I could go on and on about the work we've done in our data warehouse, our dashboards, and how it's helped our operation community leaders see things in a new light. And that has been hugely transformative, but I've said a few things about that. I want to choose maybe a different example that might sound a little more mundane, but has had some great outcomes. A few years ago, we completely replaced our HR, our human resources information system. And again, sounds like a relatively routine thing. But by being able to have a robust system that we can use to keep track of all of the ways that we interact with our employees, it's allowed us capabilities such as early pay access, visibility in terms of how do we support the hiring and onboarding process, understanding of what's going on from a training and performance management perspective, and even all the way out to how do we do a better job of providing tools to communicate with staff who's constantly remote and moving. We would have been able to provide those differentiated capabilities if we hadn't done the groundwork of putting in, those major run your business systems, because that's where it all comes together.
Great. We also have a special guest star for this webinar. My cat has joined me, Kaylee. So I don't know how long she'll be here, but if the audience sees a little furry little creature, that is what that is. So Chris, I wanted to ask you, again, earlier I had asked Frank how LCS balances cost, bandwidth, long-term value. So can you talk about how Atria does that?
We absolutely, it's front and center, especially because things are only getting more expensive. So what we try to do is we try to make sure we separate included technology, value-added technology, because there's as this population starts to transition, not everybody does want an Alexa, not everybody does want a Wi-Fi in their room, and quite frankly, not everybody needs an e-call device where they're completely independent. So we're starting to get add more personalized offerings for the resident. That way it's cost efficient with the residents that don't need the newer technology, but we're also, differentiating ourselves as being one of the few that offers, technology A, B, or C to extend length of stay.
And can you also share an example of a recent investment that you think has already delivered a measurable impact to, what you do?
Probably one of the biggest ones is this. We have a new hospitality solution that we're offering residents in their rooms. It's complicated to pick channels for a resident. However, it is an enabling service when we can be their own cable provider. So we've actually got a in-room experience similar to a hotel that gives them their activities. It's got a senior-centric remote, and it's got the ability to add on similar to a Fire Stick or any other streaming device. That way, we're not managing their add-ons. We give them the technology, we give them the tooling, and the managing of the add-ons is with the resident and their adult child. And that's extremely important because when you do roll that out, we don't have directors at every building for technology. So it falls back on typically the youngest staff member is the person that has to step up and be the IT person. So we definitely have tried to make it extremely simple, but the resident feedback has gone up about 10-20% positive where we've put this solution in. Feels more like a hotel than a senior living community. So it's been a win-win so far.
Great. So we've got about 10 minutes left. We're going to start to take it all home here. Ben, I want to ask you though, since it's been a moment since I've asked you a question. And I was actually going to ask you this after I asked Chris and Frank something, but I'm going to skip ahead to yours first. We're talking about value. From your perspective, what kinds of technology are proving the most valuable today for coordinating things like care and other services in senior living?
Yeah, I mean, I'd go back to almost where we started, which is you need to have that flow of data. So there's kind of the table stakes of fast functioning Wi-Fi and starting there. If I put my clinical hat on, it's really easy to focus on fall detection. It's hard to kind of get away from it, as in this community, what is the kind of one thing from a clinical perspective that better visibility, greater intervention is you can see kind of early outcomes. There is the area of what we call engagement. Chris kind of talked about earlier. We run a social care center that allows people at home, senior living residents, to talk with a caring center that provides often transportation advice, even empathy and things like that, which again, we had an ROI discussion mentioned before, and to kind of justify any technology spend, particularly in this economy, you need to talk ROI. But I can talk about the reduction of falls, and that's a very tangible ROI. But that patient engagement, patient satisfaction, quality of life thing that we've now touched on several times is a critical component and a differentiator within senior living. So I always like to kind of emphasize, I may only be able to provide you a difference in a resident survey about how they felt something before and after, but that can be pretty significant from a marketing standpoint and frankly, a longevity of that resident in your community.
Great. Thank you, Ben. Chris and Frank, I want to ask you this question here about what you're most excited about. Before I do, I want to share an audience comment. Someone had written in and said, I have not seen the positive response at communities with technology items of add-ons or paying for additional services. So it sounds like maybe there's still some things to navigate with regard to, how you charge residents for that, the right way to implement things. So Chris and Frank, obviously it's an exciting time right now for senior living tech. From your perspective, what is something that you're very excited about, an innovation or a tech shift in senior living that maybe our viewers today might be surprised to hear you say? And I'll start with you, Chris.
One that we're testing in a couple different use cases is the whole smart glasses. Smart glasses have come a long way. VR goggles are difficult for our communities. They actually are a fall risk for the residents that are using them because they're very jerky, very super realistic. But what we're seeing with smart glasses is ability to have the hands-free, interact. If it's a staff member, easier ability to interact with the resident. They could transcribe their discussions. They can be more focused on, listening, understanding, eye contact, the personalized side. On the flip side, for the residents, they can, some smart glasses are simple to set up. So like the simplicity on the adoption side is one thing that makes it attractive to us, because then I don't have this new support need for a new piece of technology.
Are we talking, when you say smart glasses, are we talking about like altered reality, like what Google Glass was trying to do, or is this something else?
More meta glasses are one of the bigger ones that we've tried.
I see. Interesting. Interesting. That's an area that I'm personally very fascinated in. I would love to be able to put on glasses and like look at things like a video game in the real world. But enough about me. Frank, what are you most excited about as you think about the coming year in terms of tech? And tell us about something that might surprise us.
Yeah. Well, I don't know that the topic is going to surprise anyone, but maybe a different way to think about it. And so when you ask the question, what I'll be excited about is when we stop talking about AI. And what I mean by that is today, AI is this thing that exists in isolation. It's this thing that you have to go to. We've got knowledge workers that use it to consume content, summarize information, et cetera. But it exists in this isolation. And I think for the full value of AI to be realized, it has to be so deeply embedded in our systems so that, whether it is the next best care of action, whether it is the resident or the staff member that needs extra attention, while that's driven by AI, when AI is so part of the systems we use that you don't have to think about it, go to it in a different way, that's when we're really going to start getting the promise that this technology brings. So AI is not a surprise, but it cannot be the standalone thing as it appears in our world today.
Great. All right. Well, if you've been in a webinar with me before, if you've tuned into one, you know that I like to end with advice for our audience so that they can take some things away home with them. So Frank, let's start with you. What's a piece of advice that you would give a senior living leader who is maybe tuning into this discussion and considering implementing new tech in their communities?
For better or for worse, I've got to go to the beginning. And it goes back to my almost plea to us as an industry. Let's make sure that we have the connectivity and the information security processes in place. I'm going to guess that a surprising number of senior living communities, if you had a mature technology stand done on your overall, every system you've got, you might be scared at the vulnerabilities that are out there. So, I love all the capabilities that we're talking about, but make sure you've got your footing in connectivity, Wi-Fi, and information security before you try to take on all of the opportunities that we've talked about today.
Good advice. Chris, how about you? What's some advice you might have for leaders in senior living who are considering implementing new tech?
Do what's called a Gemba walk first. Go to the communities. Document the problems. Don't jump to the technology. I can't, I get a lot of shiny devices sent to me. I get a lot of shiny emails, and, I go back to what are we truly solving? And have you spent time with the resident, with the staff? This is something transitioning to senior living 4 years ago. I spent a lot of time physically in our communities, try to do an undercover boss if I can. I just think it'll open a wealth of knowledge, and you actually see where the work's being done, not from our support centers. You're physically there, living the life that your engaged life team is, your executive directors are. So can't stress that enough.
Great. Ben, we've got a couple minutes left here. You'll probably have the last word as a panelist. So take us home with some advice that you would give senior living leaders who are considering implementing new tech right now.
Yeah, I mean, it's hard to follow on from like this duo very good advice, which is kind of infrastructure and the security to support it. And then also be careful of solutions in search of problems. In other words, figure out what the problems are. I love both of those responses. So I guess I get to do the follow on, which is once you have a safe, secure Wi-Fi and you actually know what your problems are, then I'll make a pitch for kind of technology vendors out there, which is I'm going to sound like a Nike ad, just do it. Like figure out a tech that may map to a problem and then pilot it, put it in a community, see what happens. You need to do it at somewhat scale to like approximate ROI and value, but back to how do we innovate? How do we move forward? The only way we do it is that people are taking a small amount of risk. They are actually trying out things. And again, I'll tell you as someone that sells technology, people want to operate within the senior living communities. They want to have their devices in use, and they're usually willing to pilot things at much lower cost so that you can determine if it works and it's valuable. So again, just get in there. The only way you're going to learn that it does or doesn't work is to try. But again, start with safe, stable, good Wi-Fi, cybersecurity, and actually focus on solving a problem. Don't just do it because the device seems cool.
Fantastic. Yeah, I have that latter problem, buying devices that seem cool. I just pre-ordered a Switch 2, and my wallet is hurting. All right. Anyway, those are words to end it on. So thank you everyone for tuning in. Thank you, of course, to our great sponsor, Best Buy, for making this happen. And we will see you here soon for another webinar. So thank you, everyone. Bye.